Welcome to Medicare School Daily. We are so excited to be with you here today. We've got a lot planned for today's show, but probably the most important thing is we've talked to thousands and thousands of doctors over the last 15 years, and there's been one common line, one common thread through all of them, and that is there's a plan type that they will never pick. And so we're going to be talking about that on today's show. When it comes to Medicare, what is the plan type that a doctor that we, in our experience, have never seen choose for their Medicare coverage? This show, Medicare School Daily, is brought to you by MedicareSchool.com. This is a company that my dad and I started. We've been helping people with Medicare for about 15 years now. And so there's a lot of situations that we have come across. And so our goal with this show is just to share with you what we've learned so that you can have really the best Medicare coverage that lasts for life. So we're excited to be with you here today. We're going to do, the format of the show is pretty simple. We're going to do some education. We're going to take live calls. So if you guys have a question about Medicare, about your situation that you want answered, you want help on, it can be anything Medicare related, Social Security related, or just general retirement related, let us know. We've done nothing for the last 15 years but talk to people who are getting ready to retire. And so there's a phone number that's at the bottom of the screen there that you can see. Call us. It's 833. Actually, let me see what the number is. Okay, 833-824-2004, 823-824-2004, and we would love to speak with you. You're on a public live stream, but don't worry, we are going to scrub all of the information away so that you can't be identified or anything. We want to be able to hear your questions and answer them and speak to them. So let's hop into today's teaching segment. I'll let my dad take over. What is the Medicare plan type that we've never seen a doctor take?
All right. Well, you're right. We have served many doctors, a lot of people really in the healthcare profession, period. But one thing that's interesting about docs is that most of them will tell us, I don't know a lot about insurance. And why? Because they're taking care of patients. They have billing departments that are taking all that. But what is interesting, they do know the plan they don't want, even though they don't know a lot of the details about maybe how insurance is going to work, because they're taking care of their part of the business. They're going to, eventually when they retire, they know they have to take a plan. And so as I met with them, they will never, ever take an Advantage plan, ever. Has
Why?
that happened? Well, reason is because they know exactly how the Advantage plans are going to work from their perspective, and that is that when a doc recommends something, they know that that's what that patient needs. And so with Advantage plans, there's always going to be some type of what is called a utilization review. And so those can be very annoying to doctors, because sometimes people, are diagnosed with something and doc needs to do an MRI, a CAT scan, PET scan, just to verify, what's going on to make that diagnosis. And so they know that they're going to get some kind of a pushback with every Advantage plan on all types of scans. Now, that doesn't mean to say it won't get approved eventually, but sometimes it doesn't. It's delayed. They may want some additional medical records. And so they know their patient needs something, but they can't get it because the insurance now is running interference. They're interrupting what the doctor knows is needful. I've had doctors say to me, it's annoying because they know who has to approve that test, that scan. It's somebody sitting in a cubicle, and they're saying, who's practicing medicine here? Am I getting to, or is the the person with the insurance company? And so that's annoying to them. There are times when doctors know that they're in a hurry. Something has to happen quickly, and so when these insurance companies impose these utilization reviews, not only just to pre-authorize something, but now even once care starts, now there's going to be other reviews. While care is going on, and sometimes they may give a pre-authorization for one service, but doc continues on, and then they're going to fight him in the billing eventually. And so the point is, these utilization reviews are the primary reason. And what's interesting also, Josh, they even have a post reviews, meaning after the care is over and all the bill is submitted, then sometimes they get some pushback there as well. So I'm just saying it's continuous. And so doctors hear that from the billing department, and they experience that, and they're saying, I don't want to touch this. I kind of compare it to somebody like a mechanic. Mechanics, and I'm not mechanical, that. In fact, I'm terrible with mechanics. But what I do know about mechanics that are really good, you can talk to them and they will know when something's going to happen with that car. yeah, you better watch that car at 100,000, the transmission goes out or whatever. And mechanics are under the hood every day working on cars. They know what's going to happen with most cars. And that's really the way it is with docs. They're under the hood. People in the profession see the pushback that people get. I spoke at a conference recently, and there was a lady afterwards. I do a Q&A afterwards, and she worked for a cardiac surgeon. And cardiac surgeons like to do, I think it's either an MRI or a CAT scan before they go into surgery, just to make sure they know exactly, what's going on. And original Medicare would approve that, along, of course, supplemental plan, of course. But when you have an Advantage plan, they will not approve that. So the doc's not quite as prepared going into that surgery as what they really need to be.
And they go in blind.
And well, I mean, they know some things, but
yeah.
I mean, truly, right before the surgery, they want to do that. And Advantage plans are typically not going to approve that. It's a pre-authorized service with them. Original Medicare, wow. You get it done. That's sad.
Wild.
That is wild. Yeah, and I didn't volunteer that. I mean, I didn't ask for anything. She just stood up in the whole crowd and said, "I want to share something with you." And but I've had those kind of things. I had a lady in St. Louis one day that I was speaking about this, and at the end Q&A, and she said, I work in a coding department, and we have all kinds of problems with Advantage plans, with the pre-authorizations and not wanting to pay. And so, and we're not here to badmouth Advantage plans. There are people that have to be on them, but doctors are not going to select them because they understand exactly what's going to happen. They don't want to have the resistance from the insurance company. And people that are on original Medicare and supplemental plans never will.
Yeah, let's back up for a minute. So just for maybe somebody's new, they don't really understand. Medicare's a big thing. So let's draw a couple of differences between the two ways that somebody could have their Medicare benefits.
Okay.
Could you speak to that a little bit? Because Advantage plan is one, and the Advantage plans are advertised all over the airwaves and all over the TV and everything. But there is another way. So what would be, I guess, the way that maybe some of these things that a doctor does choose? Can
Exactly. Right. And the same one that I chose. They stay in the original A and B system, which means they're underneath the umbrella, the administration of the Medicare system. And so when you're underneath that system, you're going to have almost no pre-authorizations. That A and B system of Medicare, I would just say it's very rare. Now, there is right now a pilot program going on that's called WISER. It's called the WISER model, and there's 6 states, and those 6 states are Washington, Arizona. You can look those up again. I tried to memorize those the other day. Oklahoma, I think.
Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington.
There you go. So 6 states that are on this model. It started this year, 2026, go through 2031, and they've identified 12 different services that now have to be pre-authorized by Medicare, and primarily it's because of all the abuse that occurred within these 12 pre-authorizations. So
I was reading something about like skin grafts are a huge fraud. You know anything about that?
Well, I do. The reason is because what happens if someone has like diabetes and they have they're having like wounds.
Sure.
So a lot of times they'll have some skin grafting because of that. So, but what was happening is a lot of these skin grafts were done when people were like ready to go on hospice. So it's end of life. There was not.
It's all went up like 6,000% or something in a few years.
Yeah, and it was incredible the amount of money. I mean, it went from millions to like a billion.
Yeah,
exactly right. So they identified this under Doge. They realized, hey, there's a lot of abuse here. So, and what's interesting about that, the doc still doesn't even have to have it pre-authorized, but the doc can do the service and then prove why it was necessary. And so, and of course, docs
under the WISER model.
Under the WISER model, exactly right. Okay. It is a
we kind of switch back to that.
It's a pre-authorization service, and all I was trying to say is that when people stay in the original Medicare system, they don't have a private health insurance company that even has any kind of right to intervene, to delay, to deny services. Because if original Medicare covers, then the supplemental plan has to cover. In fact, most supplemental companies will put on their card no pre-authorization required.
Right.
So they have no say-so. They follow Medicare.
Well, for years we've always said, like, if Medicare A and B pays, your supplemental plan 10 times out of 10 is going to pay whatever Medicare doesn't pay, right? As long as it's medically approved and medically necessary.
Right.
So they have no say-so in claims.
Right.
So that for if you're not sure what a Medicare supplement is, they're generally called Plan N or Plan G. Those are the two most popular plans. Plan G is still the most popular plan by a pretty healthy margin.
Right.
It's a little bit more premium, a little bit more expensive, but Plan N is also a great plan as well.
Well, Josh, when someone's going through like cancer treatment, they could get pre-authorized to start the treatment, but as treatment is going on, they have to review it again.
Yeah.
If someone's in a skilled nursing facility, same thing.
So this on an Advantage plan, you're saying? Like,
exactly
okay.
right.
So
Yeah.
it's just like a lot more ways that, and that's why doctors don't like them. It's because there's so many different ways. The insurance company, somebody in Cube, or an algorithm somewhere, some AI, saying, hey, no, like, we're not going to cover that.
The original intention was to control costs, to make sure people weren't getting unnecessary tests and those kind of things. But it's the pendulum's swung the other way, where it's now abused, where the insurance company has way too much say-so.
So I wrote down a couple of questions as we were going through this, because supplement plans, Plan G, Plan N, like, they're great. You have to have a standalone drug plan. This can start getting a little premium, like monthly cost heavy. So are you sitting here saying, like, no one should get an Advantage plan, you're going to die? Like, maybe expand on that a little bit. Because 52% of Americans are covered by an Advantage plan.
Right. I'm not saying that at all. There are situations where I think the primary thing is affordability. There are people that just don't want to afford a supplemental plan, or they can't. And so then they have to decide. But here's the thing. When it comes to affording a supplemental plan, if someone can't afford it, it's not like we're throwing money away. What you're doing is you're preparing for some serious health issue comes up. You don't have to fight the insurance company. You don't have to be, dollar to death. You know exactly what you're going to spend. I have a G plan personally. I pay my premium, it's $212 a month, and I have a deductible I have to meet this year, $283. And so, and I'm going to meet that. I had the eye issue, and so I'm going to meet the $283, and then I'm done. I pay my premium. So what will I spend this year out of pocket? $2,700. The average Medicare Advantage plan this year is $5,900 max out of pocket.
Oh,
average. Yeah, average.
So you get a Medicare Advantage plan thinking you're saving all this money. And you maybe
monthly.
Yeah, if something goes wrong, there's a good chance you're going to hit or get close or get up there towards your maximum out of pocket. And so what you're saying, your logic is, hey, I have a Plan G and a $283 deductible, and then there's 100% coverage after that.
Exactly right.
Yeah,
so and that fits my budget. So someone that says, I just can't afford that, they shouldn't even try to. Then we find the very best Medicare Advantage plan for them. Medicare Advantage, tons better than A and B only.
Oh, yeah.
That's the only option, and I would never do that. So Advantage has its place. Also, if someone is going to get their services to VA, or they're going to use TRICARE, or they have FEHB benefits, Federal Employee Health, I mean, there's a place for Advantage in those kind of systems. I don't think those people need subs. But there is a place. If they qualify for Medicaid, they're not going to get a med sup. They should get a Medicare Advantage plan. So there definitely are places for them. But what I get frustrated by are the agents that push the Advantage plans, convincing people that don't you want the little dental allowance and the hearing aids.
I think the reason that's become so popular is because the plan premiums have been driven down to basically zero, right on a monthly cost.
Right.
So what's easier to sell than free? Nothing. I mean, like, you can't, hey, this is a free plan. Like, you got all this extra stuff. And it sounds good until maybe you go to use it. But I do just want to mention, if you're listening to us today, we are not, as a company, anti-Medicare Advantage plan. So we have a team of people, agents licensed in all 50 states, help people all over the country every single day, all day long. Help people enroll into supplements and Advantage plans and drug plans and dental plans and all of these things. And 25%, so 1 out of 4 people that we talk to are choosing an Advantage plan. So we're not anti-Advantage plans. There's a lot of people out here, maybe on YouTube or whatever, that you may watch, and they just hate on Advantage plans. We believe they have a place. Correct?
We do,
and so
they do have a place.
Yeah.
But at the same token, I think we can be very neutral in it. We're educators. We just want to make sure that you know how your insurance is going to work. And the reason that the majority of agents push Advantage is because they pay twice the commission. I mean, that's frankly what happens. And they pay lifetime residuals. So financially, the agents are biased towards Advantage because of that. I mean, they
get paid more. It's free, so it's easy to sell.
They're conflicted.
Yeah. And I mean, we talk to agents all the time, all over the country, and it's interesting. It's like they don't know about supplement plans. Right. They come up in this industry and they're just like, oh, we sell free Advantage plans. Like, that's what everybody gets. And it's just not the case. Right. We've got some callers, so I want to get to those. If you are a doctor and you're listening to this show, I want you to call in and tell us if you chose an Advantage plan or not. We'd love to hear from you. I'd be curious if there is actually one out there.
Or a nurse.
Yeah, or a nurse. Or
I've
somebody
never had
in
a nurse
healthcare.
take an Advantage plan either.
Yeah.
So, yeah, I'm sure they're out there.
Yeah, I'm sure
I
they're out there.
I haven't experienced it.
Okay, let's go to the phones. Remember, if you want to call in and talk to us, ask your Medicare, Social Security, retirement question, phone number is 833-824-2004. 833-824-2004. We'd love to chat with you. So let's get to our first caller. Hello, welcome to Medicare School Daily. What is your name? Where are you calling from?
Columbus, Ohio.
Hi, what's your name?
Wendy.
Nice to meet
Wendy.
you. What can we help you with, Wendy?
My question is about Medicare Advantage.
Okay.
As somebody just coming into the system, can I go right to Medicare Advantage, or is there a waiting time? And then maybe if I don't like it anymore, is there a waiting time to get into A and B or supplemental plans?
Okay. Well, first off, you have to be enrolled in A and B to be able to have an Advantage plan, Wendy. So you can't. You go ahead. It's fine.
Did you say I have to do A and B?
Yes. Yeah. You
Both?
cannot get an Advantage plan or a supplemental plan unless you're enrolled in A and B both. Yeah.
Okay.
And
I was thinking I would just start with A.
okay. Yeah. You cannot. Now you can if you're going to continue to work, and you're covered by a group plan that has 20 or more employees in it. You can just have Medicare A only.
What's your are you turning 65 soon or?
Yes. Mm-hmm.
Okay, when do you turn 65?
May.
May. Okay. And are you working right now or are you retired already?
Yes.
You're still working?
I'm working.
How long do you plan to continue working?
As long as possible.
As long as possible. Okay.
20 or more employees on the payroll at your work?
Yes.
Okay, good.
How are those benefits? What do you have to pay? Like what comes out of your check?
I pay $1,400 a year, $1,422 a year.
$1,422 a year. And is that just for you or is there any dependents or anyone else?
Just me.
Just you.
me.
Okay. So you're spending $120 a month, whatever.
Yeah, not much.
And is there a deductible? What's the max out of pocket? Those are two separate questions. Do you know either of those?
I do.
Okay.
My deductible for my medical is $3,400, and my maximum is $6,400.
Okay, $3,400.
Hey, Wendy, do you ever get close to meeting that deductible?
No.
Okay, not at all. Okay, so do you take any medications?
No. I mean, there was a time when I did, but right now, no.
Are you happy with the network that your company has selected? Meaning that the coverage. So whenever you need it, it's been there for you. You've been pleased.
Yes.
Okay. And are you contributing to a health savings account?
Oh, that's a very interesting point. They did not allow me this year because I am turning 65. So I understand that that's very important for me to get A because of that.
Yeah, well, here's the thing. Whoever told you you cannot contribute to an HSA is totally wrong. Okay, totally wrong. Now, if you did enroll into A only, you cannot contribute to your HSA. But as long as you don't enroll into A only, and you don't have to, as long as you don't enroll in A only, you can continue to contribute to your HSA. And it's not too late anyways because you don't turn until May of this year. So you're fine. Even if you did take A only, you can contribute to your HSA all the way through April. And right now that's about $450 a month maximum on the individual plan. But you can continue. Go ahead.
I mean, were you using HSA before?
I did have one last year, but when I did my enrollment for my insurance, they did not allow me to continue it.
How much do you have in your HSA? I mean, have you built up quite a bit, or just a little?
No, I spent it all before.
Okay, you spend all. Okay, makes sense.
Very good. And again, you did get wrong information about the HSA, but that's neither here nor there. What I would recommend doing, and Josh is going to look at some rates for you, I guess. But do you want to look them up per zip code?
Let's touch on the Advantage plan. So I think the original question was, can you? Yeah, maybe restate the original question. Yeah. We've got a little more context for you now. So
I wanted to know if I'm thinking, like, right now I'm just going to keep my what I have and enroll in A, but I'm thinking down the road when I no longer have options for my employer coverage, I would jump into the Advantage plan, but I don't know if that's possible.
Yeah, it is possible.
Yeah, absolutely.
Yeah, you can add an Advantage plan within 63 days of losing your employer coverage. I wouldn't wait 63 days. I would do it once my employer plan ends. Then I'm going to get everything set up in advance so that my employer plan ends and I go on Medicare. So you can roll in Advantage plans up to 63 days after you lose coverage. And then you do not have to medically qualify to get an Advantage plan. So it's really quite simple to do that. And then there's twice a year we have to change the Advantage plans if someone wants to. So the Advantage would be available to you.
Did you say I have to get B2?
In order to get the Advantage plan, yes. Mm-hmm. Yeah, so generally the way, like if you're going to stick with your, employer coverage till you retire, the best thing you can just remember is, 90 days before you retire, contact us, contact a broker, contact somebody who can help you. We'd be honored to help you, but there's going to be a couple forms that have to be filled out. One's called a 40B. One is called an L564. Those are both Medicare forms, and that will allow you to enroll into Part B, right, with no penalties or anything. One, your employer has to say, yeah, she's been 65, but we continued, she was covered by the group plan, and that makes sure there's no penalties, and the 40B form is just the application for adding Part B. So those two forms go to the Social Security office. And then from there, right, once that's been processed, I would do that 90 days in advance of retirement if you can. Then you have the option, or the choice of like, okay, what is the right Advantage plan for me? And again, as a broker, we'd love to help you out with that. But that's kind of your steps. You could get a supplement plan as well. There's going to be some premium for that. Supplements tend to be maybe our preference, but they got to fit in the budget, and we understand that.
Wendy, are you
Okay.
clear? Are you clear on this?
How about going back from Advantage to A and B, or to a supplemental?
Mm-hmm.
Yeah, so
there's only 2 times a year. Or?
Well, now generally speaking, so whenever you first get Part B, okay, you have what's called a Medigap open enrollment period, and that's a lot of jargon, but it just means this. Within the first 6 months of your Part B starting, you can get a Medicare supplement plan like a Plan G or a Plan N without any medical qualification. Okay? So that's from 6 months from when your Part B starts. Generally speaking, let's say you go on the Advantage plan 2-3 years, you like it, something changes in your health, and then you want to switch to a supplement plan. You're going to need to medically qualify to get into that supplement plan. So you have this once-in-a-lifetime right that is that 6-month period, right, that starts on your Part B date in order to get that. And so you just got to be really careful of that. So some people think they can switch between Plan G and Advantage and Plan G and Advantage and Plan N and Advantage every other year. That's not the way it works. What state do you live? Oh, you live in Ohio. Mm-hmm. So yeah.
Mm-hmm. Yeah. Mm-hmm. Yeah. I want to clarify something that you may have heard. When people first go on Medicare A and B at 65, they do have across the country what is called a trial right. That's the first 12 months on their Advantage if they start at 65. They do have the right during the 12 months to return to original Medicare, get a supplemental plan, no underwriting. But as Josh was saying, if you stay on the Advantage plan, as most people do, longer than 12 months, the only way to get on a supplemental plan is to go through this medical underwriting. And that means we ask you about 40 health questions. We check your medications. So there is a process, and the insurance companies do not have to take you at that time. And that applies in every state but New York, Connecticut, and Massachusetts. So you live in Ohio, you're going to have to medically qualify to get a supplemental plan if you're to stay on that Advantage plan. Now, another thing that matters is that if you have your A date now, which I think you're going to enroll in A, and you pick up B 3 years later, you may not have that 12-month trial right. That varies state to state. So that's why Josh was saying if someone wants a supplemental plan, we know at all times they always have the right to get one around the B date, and that's 6 months. And so it's really critical because a lot of people are not aware of that. They think because Medicare has this open enrollment season every year, they can move around and switch without rules, and that's just not true. And we'll be here to help you, when it's time. But right now, Wendy, if I were you, you're paying $120 a month. You don't ever reach your deductible. You've got very good insurance. If you are done with the HSA, take A only, and then you can pick up B at a later date using the special enrollment period. And now all that has to go, it doesn't go to local offices. Yeah. It all goes through, all those things have to be uploaded, downloaded, whatever. They change the system.
The only thing I would say, Wendy, is if something does change in your health, you will probably save money by going to Medicare with a Medicare supplement plan. So just keep that in mind. Something comes up down the road, you're starting to, I'm probably going to hit this max. Oftentimes those employer group plans want you off their plan, so they'll allow you to go on Medicare, middle of the year, whenever, once you're 65. So just keep that in mind. So, yeah, thank you. Nice to chat with you.
Appreciate the call today, Wendy.
If we can help you, let us know, okay?
Thanks for your time.
Thank you.
Bye-bye.
Bye-bye. Kind of an interesting situation. Mm-hmm. I mean, it's pretty standard, but I always kind of think, like, if your max exposure is $6,400, you're not going to spend that much if you go on Medicare. You're going to spend like half that much. Right. So I would always be in probably the camp of, like, if her max out of pocket is $6,400 plus $120 a month, right? So it was $1,422 plus $6,400. So, like, her max exposure is $7,822. That's what, if everything went wrong, that's what she would spend, right? So let's compare that to Medicare. So she's going to, A is free, B is, what is it?
It's called 203.
203 times 12. Plus, let's say G plan's 140. It's probably less than that in Ohio. Let's say it's 125 times 12. Times 12. Drug plans are often free, but let's say it's $10 a month. 10 times 12. Plus a $283 deductible. Her max exposure is $4,363 on Medicare A and B with a supplemental plan G, paying the deductible in a drug plan. So that's $3,500 difference. Right. I know, that's the way I always look at it. I don't know if you ever look at it that way, or if you're just like stay on the group plan.
No, well, the way I know the way most people look at it, and that is if they're healthy and they've never used a group plan, they're looking at one thing: $120 a month to be on that plan at work. And I think people also, Josh, are concerned that, hey, if they get off that group plan at work, can they go back? If they, something were to change. So I think there's.
But of course they could, because they can't be declined.
Wouldn't
that be age discrimination?
They can add it during the company's open enrollment season. Yeah. Exactly. Right. So I'm just saying to you that I think that's the mindset of most people. But I had a guy not long ago that was paying $600 a month for his group plan, $600 a month, and had a $5,000 max out of pocket, deductible included. And so it was a terrible plan. Yeah. So people that are turning 65 that have either lousy or mediocre average group plans, I encourage them. Make the comparison between Medicare and the group plan, and Medicare sometimes makes sense. Yeah. Now, if there's a spouse that's on it that has nowhere to go, or children covered to age 26, nowhere to go, that's another issue. But there are many people that have really average to mediocre group plans, and Medicare is a great option. Yeah, for sure.
Okay, let's get to our next caller. We're ready. Hello, welcome to Medicare School Daily. What's your name?
Hi, this is Terry.
Hey, Terry, where are you calling from?
I'm in Virginia.
In Virginia. Well, welcome to the show. What can we do for you? What questions do you have?
Actually, I set up the Medicare just a while back, filed all the paperwork that was necessary, and delivered it to the Social Security Administration. I started to get some billing, though, that I just want to run the numbers by you and see if it sounds like it makes sense. One came through the bank account that had no other indicators other than letters HNHIC premium for $136. I don't know what that is.
That's your Medicare supplemental premium, and that's from
Cigna.
Cigna. Mm-hmm.
Do you have a Cigna supplement plan?
Yeah, G.
Yeah.
So that would come out of your bank account. Yep.
Yeah. Okay, that makes sense then.
And by the way, hey Terry, let me explain something real quickly. When someone first applies for a MedSup plan and we set that up, the company will, of course, they'll approve the policy very quickly, and then they do the first month's bank draft to issue that policy, so you can get your cards and everything is all set up. and then after that, then they will draft the month of. So you just pay that first month in advance, and then your second month, and you probably, if you're going to draft on the 1st or the 10th or 15th or something, then you'll pay just the month of. So the first one's always in advance. So that's probably why you saw that, even if you came a little bit early. Go ahead.
Yeah. Okay, that makes sense. It's just that all indicators was HNHIC, and I wasn't sure what that was.
Yeah, it's Healthcare Service Corporation. So HCSC.
Okay.
So
the other one I received was from Social Security Administration itself, and it has just one line, and it says Part A 0, of course, Part B 1,040, and IRMA 0. So I'm trying to. How does the 1,040?
Well, it's 5 months of your Medicare Part B premium. You're obviously not on Social Security. That's why you received a direct bill. So what they do is they mail you. Your first bill is always 2, 3, 4, or 5 months. I got the same bill you got. Mine was 5 months. It's truly, and I've asked a couple different times, how's this work? I can never get a clear answer. Then it's kind of like the lottery. When someone goes in and does a self-enrollment, the one person gets a 2-month, the next person in gets a 3-month, the next one 4, next one 5, and it rotates all day long. And I've had that answer a couple times, so that's what I go with. So you got the 5 months. So when do you start your Medicare? What month?
I think they indicated June.
June of this year?
Yes.
Okay, so when's your birthday? Okay, very good. So that would be
59.
June, July. Oh, 59?
Yes.
Oh, okay. Okay, very good. Well, anyway, so that's what you got. You got 5 months worth of Part B premium.
Does your employer, does that coverage end on May 31st?
From the employer?
Yes.
They have a different kind of cutoff thing. It actually ends in July.
Okay,
1.
so you're going to have like 1 month of overlap.
Yeah.
Yeah, okay. Well, be careful when is that going to create billing issues for him, Dad?
What's that?
I mean, just be careful which one he uses, I guess, right? Like if he goes to the doctor in June, what should he use?
Yeah, well, if the employer is more than 20, your employer plan is going to pay first, and your Medicare is going to pay second, and then your supplemental plan would pay third.
Okay.
Yeah.
You'll have a lot of coverage for 1 month.
Yeah, exactly right. So, but it is important. Josh is right, and that way, so if you do go in June, I mean, just go ahead and give me your Medicare card and your supplemental card.
Right.
Yeah, because it could still create some problems when that bill goes in. I'm just telling you, your group plan is going to pay first, and then what happens? The group plan will cancel effective July, and then you have to remind your providers that you're just totally on Medicare.
Yeah, if you go in, July, once that employer coverage ends, you're going to need triple check with every service you get and say, hey, guys, the group coverage no longer needs to be billed. I just need to have Medicare A and B and then the supplement. And so there's an issue that you're going to run into probably called crossover. Yeah, and so you end up having to call Social Security, right? Or is it Medicare?
No, it's Medicare.
Yeah, so you end up calling Medicare, and a little tip on that, they're open 24 hours a day. Call them at 11 p.m. and you'll get right in.
Yeah, I'm going to give you the number to crossover because I'm telling you, Josh is right. I would do.
You're going to have an issue.
I would do this,
and it's easily fixable, but you will have an issue.
Yeah, and it takes them about 10 days though to get it corrected in their system. So all we're saying is that I would make this call. I'd probably call maybe mid-June if I were you, and let them know that your coverage at work is going to terminate at the end of June. You're fully on Medicare, and your supplemental plan July 1. I'll give you the number if you want to call them. I definitely would if I were you. Okay, you ready?
Okay. Yeah,
okay, it's 855 798 2627. 855 798 2627. Okay, so let's go back. So your Medicare is going to start June. So that's June, July, August, September, October. So that's your June through October premium. And then after that, Terry, it'll be on a quarterly basis. You'll get a 3-month bill until you start taking Social Security. Now, are you going to delay Social Security for a while, or are you going to take it soon?
No, I've always filed for it. Everything came up quickly because I was technically on a layoff status.
Okay.
But then at the very last minute, that didn't occur, so I'm still employed. And
so are you taking Social Security? Are you taking Social Security?
Yes.
You are?
Yes.
Okay, and when do those benefits start?
Mid-May.
Mid-May? Okay. Well, here's my advice to you. I don't think I would pay that bill if I were you. And I just wouldn't, because I'm telling you right now what's going to happen. You pay that bill now. Of course, it's not going to be due until May 25th anyways. I'm sure you look at your invoice, you can see that. So if you're going to start Social Security at the same time, the reason I wouldn't pay that bill is because you're going to pay it, it's going to go on credit, and then they're going to turn right around, they're going to start deducting your Part B premiums right out of your Social Security check. That's what's going to happen.
Oh, I see.
And then you're going to have to fight for about 6 to 9 months to get that money back. Okay, I'm just telling you that's how that's going to go down. Now, listen, what I would do if I were you is I wouldn't pay the bill, but I would call the national line. In fact, the system just changed the 7th of March. So when you call now Social Security, you're not going to go into a local office. You're going into a national switchboard, and then they're going to direct you to the first available rep somewhere in the country. And you can get their advice and just say, hey, I got a bill, but I know I'm going to start Social Security, and so should I pay this bill? And I think they're going to tell you don't pay it. We'll go ahead and take your Part B premiums out of your Social Security check. So if you want to call them, and that would just be the Social Security Administration number, the main 800 number. Okay.
Will he get an award letter from? Have you gotten anything from Social Security yet saying what your benefit's going to be and when it starts and all that?
No.
Because I bet on maybe I'm wrong, but on that letter it will talk about Part B as well.
Yeah, I think it will.
So Medicare probably processed a little quicker. Social Security is taking a little bit longer, but by the time the Social Security award letter comes out, they're going to know about your Part B. It's going to say, hey, here's what your monthly benefit amount is going to be. Here's how much is going to be reduced from your Social Security check for Part B, and it will also include what date that kind of all begins. So hang off on paying the bill.
Yeah, I definitely would wait a while. And I know it says May 25th due date anyway, so you have time. So I just watch the mail a little bit, and then I think they'll tell you, hey, we're going to take this out of your Social Security check. Okay?
Okay.
And then could do that crossover issue, call them in mid-June and tell them, hey, the employer plan's ending. Yeah. Most people don't have to do that, but because you have this overlap in coverage, it probably is going to create some issues. And it's a 10-minute call.
Yes.
It's not the end of the world.
Yeah, they're really, really responsive. It's a great department. Okay.
Call in the middle of the night, though. Yeah. You'll get right in.
All right. Anything else, Terry? Are you good?
Yeah, real quick, if I could.
No problem.
I don't anticipate using any of the medical benefits, but right away. But I was considering a dental appointment, and it's through my work, but it's a private. It's Delta, so they're private. Mm-hmm. Would that create a problem similar to what we were just talking about?
No, not at all. Go ahead.
Yeah, no, it won't.
Okay.
Are you keeping that dental plan after you are done at work? Can you keep that plan, or?
No, I already. You guys already helped me.
Got to switch to another one. Okay.
Yeah. Once you stop paying the premium on that dental that Delta, it'll go away. So the one we set up for you, does it go effective July 1 or June 1?
I don't have it in front of me at the moment, but I think
fine.
June 1.
Okay, very good. All right. No problem at all. Yeah, those are individual plans, and you don't have to worry about crossover at all.
Okay,
Terry. Hey, thanks. Appreciate it. Nice to chat with you. Thanks for letting us serve as your broker, too. We really appreciate that, and consider it a privilege.
You guys are there.
So, yeah. Okay, hey,
really
thank you.
Appreciate the call today.
All right, have a good day. Bye-bye.
Guys, if you are starting Medicare soon, right, and you need help answering or figuring out, do you need a Medicare Advantage plan? Do you need a Medicare supplement plan? What do you need to do for drug coverage? What does dental benefits look like with this, with your situation? We have a team of people here at our office that come to work really every day, and they just want to help people understand Medicare and then help them compare, get quotes, and enroll in coverage that really is right for their situation. So if you're in that camp, Medicare is coming up soon, or maybe you're on Medicare and you just want to do a coverage review, we would love to speak with you. I'm going to tell you a different phone number than what's on the screen. The phone number on the screen, you can dial in to talk to us live on the show. But if you want to schedule an appointment with one of our agents, phone number is 833-833-3661, 833-833-3661. We consider it an honor to help you. And really, the most important thing to us is, yes, we want to help you enroll, but we also want to provide service for life. So you get assigned a dedicated client care manager that anytime you have issues, billing issues, card issues, need to change your coverage because you're moving, whatever it is, we're going to be there for life to help you. So call us 823-833-3661, schedule an appointment, or talk to somebody here in our office live to get signed up for all of your coverage. Okay, let's hop to. Oh, and the other thing I want to mention is that service is free, right?
Cost.
We there's no cost for that. We are insurance brokers, and so we can access pretty much all the insurance companies that are filling up your mailboxes and help you walk through your situation. So let's get to our next caller. Hello, welcome to Medicare School Daily. What is your name?
Hi, this is Angela, and I'm calling from the great state of Virginia. Thank
Angela
you for
from
taking my
Virginia.
call.
It's funny. We had two people from Ohio, and then we've had two people from Virginia now. So everyone's coming
Yay!
in. Everyone's coming in double
Your
batches.
lucky day.
Our lucky day. Well, thanks for calling. What is your question? What can we do?
So mine is going to take a short time. I turned 65 in May,
Okay.
and I applied for survivor's benefits,
Okay.
which had to be done by phone. My application was in February, and I asked them to start in April because I think Marvin said in one of his prior shows that they always pay in arrears 1 month.
Yes.
So they said, okay, we'll begin in April. Well, I was talking to a really nice agent, and she said, I told her, I think I triggered Irma.
Okay.
And she said, so what you need to do right away, and this was like a week ago, she said, get Form SS44. She goes, oh, I'll go ahead and mail it to you.
Okay.
She says, or you can go online and upload it, complete it and upload it. So I went online, and I realized that there's a step 3 that requires info from my tax return for 2025. So, and I haven't completed the taxes yet. My accountant's working on them.
Sure. Do you have an
So
estimate
my question was,
of what your income's going to be?
well, it's a little tricky because there's some other income involved.
Okay.
And
So
so
can we
that's
ask you
why I
this real
haven't-
quickly? Your life-changing event, is it work stoppage? Is it because of death? What's the life?
It's work stoppage.
Okay,
It's
very
work
good.
stoppage.
And what was
Yeah,
that date?
and,
What was the date of work stoppage?
It was May 31st of 2025.
Okay, very good. I just wanted to get that.
Yeah. Yeah. And I was on Cobra, so that was one of my other worries, was that somehow, Cobra was an exception and that I would have to fill out another form, but that turned out to be incorrect on my part. So she said, get this form in ASAP. Well, I just got my Medicare card. They turned it around like within a week.
You're one of the lucky ones.
Yeah. Well, I don't know going forward, but
Well, no.
so my question is, do I wait until I submit this form to call you? Because I'd like to be your client.
Oh, you
I
mean like
I
for the
want-
supplement or whatever?
Yeah.
Yeah.
I want to get I want to sign up for a Plan G dental, and the drug plan.
Yeah, you don't need to wait. Those all this stuff is pretty independent of each other. So you have a Medicare card, you are good to sign up for, your supplement plan, you're
Yes.
good to sign up for drug plan, all of that. That can be done anytime. I do want to just touch on the
Okay.
other thing, and I don't know the answer to this. My dad, I'm going to ask him. So Dad, is there some urgency that she's got to fill out this SSA 44? Can it be done here in when she has her tax return done, presumably in a month?
They will definitely retroactive it. But the reason she probably feels some pressure is if you got the IRMA letter, it always says they want to hear from you within 10 days. Because if you're going to appeal it, they want that appeal in as soon as possible so that they can get everything correct.
Yeah.
So, there is no sense of urgency. But here's what I would say. Let me ask you this first. So they look back at 2024. What's your IRMA amount? How much is it?
Oh, you're not going to believe it. $109.50.
Okay. Okay. So it's the. Okay, so you have 202.90, and you're saying it's the 109.50.
Well, wait a minute.
So you
line 11.
Oh, okay.
It was
okay.
actually
I'm sorry. You go right ahead. Line 11.
okay. Line 11, and I think it was line 2, right?
Line 11 is AGI, and line 2 is tax exempt interest. Mm-hmm.
Which is 0 for me.
Yeah, most people it is. So what is line 11?
Yeah, I learned that from you. So it actually came. I think it was 111.
Okay, 111.
So she's just
above.
over.
Yeah, that's right. So you'll be at that first IRMA level, and you're saying in 2024 or in 2025, because they're looking at 2024 right now. So that's really what
20.
No, let me back up.
24.
Yeah, they're looking at 2024, right? And you're saying it's 111. Okay.
Yeah.
Okay, good. So now in 2025, is it going to be less than that?
Oh yeah.
Okay.
Yeah.
Good.
Because as of May 31st, 2025, I was unemployed.
Okay, that sounds good.
I mean, do you think it's going to be, because you can also write an estimation in there. Yeah. I mean, do you think it's going to be under $100,000?
Yeah, but as long as it's below 109, you're fine. If it was 108, you're fine.
I was afraid to estimate because this whole thing has me worried that I'm going to get audited or something.
No.
So I didn't want to put in numbers. I wasn't absolutely positive.
Okay, let me ask you this question. If you were to estimate right now, what would that be? How much?
Oh, it'd just be under 100.
Okay, then
put 99.
Yeah.
No one
or put 105.
Yeah.
It is fine. I promise you. As long as we're below 109, it will not matter. So if you think it's going to be 100, put 105 down. That'll give you some comfort level, and put that in the section. You put your life-changing event. Put the date in here in the very next section. That's the only one you have to fill in. You do not have to fill in the one that's at the bottom.
Right.
You don't have to.
3 steps.
Yeah, you don't have to do that.
Yeah.
Mm-hmm. Don't worry about the third step. It's not necessary.
I thought the third step was the estimate. That's where they asked you for the estimate.
No, I'm not looking at the form right now, so pull it up real quickly. So
Okay.
The only thing I will tell you, we've done thousands of these over the last 15 years. Have we ever seen one come back or somebody get audited?
Never.
Nothing.
Yeah, I just want to look. I'm sorry. And I'm sorry. I've done lots of them, but look at the form. Okay, so you're going to do step 2. You're not going to do step 3. Don't worry about step 3. It's not necessary. Just put your step 2 down, and you're going to put in 2025. And then you're going to write where the adjusted gross income is. You're going to put in $105,000. You're going to put 0 under tax exempt. And then are you single or are you head of household?
Single.
Single. Okay, you're going to check the single mark, and when they get that form, they're going to see that you're below 109,000, and they will approve your IRMA appeal.
They're pretty liberal with these approvals right away, because it's going to take them a couple of years to a couple of years down the road. This will get referenced whenever it's time to kind of look when that tax return has been filed. And then they will, there could be, if you were over the 109, they might come back and ask
They
for.
would.
Yeah, they're going to come back and ask for that IRMA surcharge again. But don't worry about being to the penny.
But I didn't get my IRMA letter yet in the mail.
Well, then, you can't appeal yet. Then either. Yeah, you have to wait. We have to wait.
Just wait. I thought you had gotten it already. Yeah. This is just the lady saying you need to appeal it.
Yeah, the agent told me to fill it out and submit it ASAP.
Mm-hmm.
And then I was thinking, well, wait a minute.
Yeah, I will tell you.
Letter.
That's right. Yeah, I would not do that because it's not showing up in the system. So if you were to send that appeal form in, there's well, what's this for? We don't even show that she has an IRMA, and then it's not going to get processed. So I would wait till the letter comes, and then once it comes, then do just what we had suggested. And so I do know this. I think I would definitely try to do this online if I were you. In the old days, we'd have you print it out and send it to a local office, but they've changed the system. So I would do it online, but I would still wait till the letter comes. I just would, and you'll be just fine with that. Okay, and put in 105.
I did. I opened an account online just for this purpose, so that I can monitor from now on.
Good.
And so when she gave me, I jumped right on, and then when I got to what I thought was step 3 and I needed numbers, I was like, oh, no.
Yeah,
You
you
know,
can
I
estimate.
haven't even done my.
Yeah. Do you just fill in the
Yeah.
one, leave step 3 blank, go to page 3 and put your name and
Sign
address,
it,
sign it, and
yeah.
you're probably, that's all you need to do.
Well, evidently, I haven't been paying attention these last 2 years.
You're
Yeah.
fine. Hey, Angela, I'm going to give you another phone number to write down to schedule an appointment because you said you want our team to help you with supplements and everything and drug plan and
Yes.
all that.
I got a pen.
Okay,
Okay.
the phone number to call into our office is 833-833-3661. 833-833-3661. And you're good to go anytime. You've got your Medicare A and B card. You're good to go. So,
Very good. Thank you
okay.
so
Hey,
much.
nice to chat with you, Angela.
Yeah, thanks for calling in today.
And you as well.
Okay.
Bye-bye.
Take care, and I love your show.
Thank you. Glad you do. Thanks. Take care. Hello. Welcome to Medicare School Daily. What's your name? Where are you calling from?
Hi, my name is Nanette, and
Hi.
I'm calling from Florida.
Well, welcome to the show. What can we do for you?
Thank you. So I have a question. I am a cancer. I call myself a thriver. I'm still in the process, but I was diagnosed about 3 years ago, and I'm under the typical Medicare age.
Okay.
Your team helped me when it became time within the past year to roll into a Medicare plan because I have a cancer that actually has it's really complicated and unique. I was directed to one of the top cancer centers in the country, thankfully not too far from where I live, on very expensive medications as I continue. And the only reason I preface with that is that your team helped me to find what turned out to be a Medicare Advantage plan that would work with me because I'm under the typical age.
Sure.
You know, my initial thoughts were, I would, in a healthy state, I would age in at 65. I would get Medicare A and B in a supplement, and that may still be in my future. But it became very complicated. I'm kind of put in what I think they call a catastrophic category as far as the insurance world calls. And so I did find really only one plan that covered my expensive medications that actually enabled me to go to my cancer center. And as the time came about for January 26th, I made the appropriate calls to the cancer center and to the insurance. And at that time, it was all, green light, yes, still covered. So I did not make any changes. But then I got a letter about 6 weeks ago that the insurance plans to move the cancer center and all of my doctors out of network. And it's already expensive in network. So
Have you talked to the cancer center about what plans they take?
Well, and the answer is I've spoken to both. I've spoken to the insurance, which is a Medicare Advantage PPO that you guys were wonderfully able to help me find. But I've also spoken to the cancer center, and I'll be honest with you, they're not communicating the same thing. I'm not getting the same feedback.
Okay.
So I am learning about some possible plans that may be suitable to make a shift to. The shift won't be necessary until July 1st, but the actual questions that I have for you are, I understand there's an open enrollment for Medicare Advantage plans now.
It's got 2 more weeks.
I understand.
Okay.
This is my real question. This place, the cancer that I have is, I've been told once, it's considered catastrophic.
Sure.
I'm doing well. This cancer center has saved my life.
Sure.
But I think the question I have is, if I have to change mid-year, whether it's 2 weeks from now or if I fall into some special category for Medicare to extend it until it ends, which is July 1st. Does that mean I dial back to a zero of everything, out-of-pockets, deductibles, prescription, the $2,100 Medicare prescription? Because it's an expensive cancer and it's already been a costly year. So I guess what I'm trying to understand is if I make that change, am I dialed back to zero?
Well, not on the medications for sure. The medication would carry through on a different Advantage plan. The $2,100 max would apply. Now, as far as the max out of pocket from one Advantage to another, I can't answer that question. I would think she'd have to reset the clock, but I'm not positive about that. Honestly, I've never had that come up. Are you going to Mayo?
No.
Okay,
I'm
you're not
actually at Moffitt.
Okay, very good.
And they're right up there. They compete for number one, but they're both.
Sure. Okay, right. So what you're saying,
I believe it resets your out of pocket on your Medicare Advantage.
Yeah, that's
plan.
what I thought.
But the drug part, I think, would carry through.
Yeah, it will. It will, because that's
a comfort.
Yeah.
That's at least something.
Right.
Yeah, they would have to honor that $2,100 max because that's set by Medicare. But yeah, the medical, I think you would have to reset. So how close are you to 65?
So I still have about 2.5 years.
Okay, a ways. Okay, I just was curious on that one. Well, we would be happy to help you. I think what I hear you saying is that you just found out that the network changed, and so they gave you that deadline of up till July 1.
Yeah.
Yeah, that's right. Yeah, they have to continue on with the care. They can't disrupt it midstream like that. So, have we discussed, or have you discussed what may work for July 1, or that's what you're still exploring?
I wanted to speak to you. I will be speaking to one of your team members to just sort of sift this out. My real concern is this: the care I've had, because, and I'm not trying to be, I'm not exaggerating. It's kind of amazing that I'm alive. Wow. There's most people that have what I have with the complicated mutation that it has. They don't have a lot of data on for how long this goes through. And I don't mean that to be morbid. I'm grateful. I'm super grateful. Yeah. But I also realize that this place that I'm at with these doctors, I mean, they have really been at the cutting edge, and that's why I'm able to speak to you today.
Sure. Well, I'm glad to hear that.
I'm not eager to depart
to
from
switch
them.
Yeah. I think you're going to have to lean on them pretty hard to try to understand which Advantage plans they take, and then we can also, work on from our end and check all the ones that are available in your, in your county or whatever to see what plans look like they're still in the network. And it's going to be kind of a both and, I think. Provider directories are somewhat notorious for not being 100% reliable. So. I think it's going to be what from the Moffitt, is it Moffitt?
It's Moffitt.
Yeah, what plans are you guys going to work with since you changed changed the network and dropped whatever Advantage plan you're on?
Moffitt says they didn't do it. They said that obviously
either way, it sounds like it's dropped, whether they initiated or the insurance carrier initiated it.
It's a contract issue between insurance and
sure.
Moffitt. It's enough ability to understand this that I'm dangerous. But here's my other concern. What I'm asking for is also, and I appreciate the information, even about the prescription meds. It's like a $30,000 a month medication plan. Yeah. And so just knowing that, okay, I can, and $2,100 at this point, I have a very crazy disease. I got pulled out of the workplace because of it, and I'm not able to return to it. And so again, I'm not playing a small violin. I'm trying to sort out how to move through this new piece of information that I actually called in December to both places. And I think I understand what happened. The contracting at that point, they were both able to go, yeah, this is covered. And now moving into halfway through the year, this has changed. But the other question I have is, I know Medicare has, I think, what they call special enrollments. If I at least fit a special enrollment, I could have a little more time to sort through.
Yeah, it would be nice if you did, but I think you're going to have to work from both ends, and you're going to have to work quickly to find out if there's a plan that Moffitt and whoever's making the call, whoever it is, but like that there's going to be a plan that's going to be a network, and then you need to, we need to get you enrolled in that plan so that your coverage doesn't, your care doesn't have to change. Maybe your coverage changes, but the, being able to go to Moffitt doesn't change. So we can help you from our end, but my suggestion would be to do as much research as you can with Moffitt and say, hey, what are the Advantage plans that you're going to work with for the rest of the year? And then let us kind of verify that on our end, work back and forth, and then we'll get you enrolled, by the end of the month, though. I'd hate for you to lose access to that July 1st.
Yeah, especially if there's somebody else that Moffitt will take. That's really a very easy move to make for you. So I wouldn't run the risk either if I were you. I would do just what Josh said. That makes sense to me. So.
Because, again, I was feeling like I was getting literal two mixed messages from each organization, and I'm like, okay, I want to make a solid decision here. This has been a significant life event, and so I need to move with less. I mean, it's got to be expedient, but I need to make good, solid decisions. Yeah. So I really appreciate you.
Well, you're welcome.
Nice to chat with you.
And let us help you, because we will. We'll come alongside you and just give you the honest advice and the best advice that we can come up with as well. So give us a call, okay?
Okay.
I'm glad you're doing
take
well.
care. Nice to chat with you. Best of luck. Guys, thanks for being here with us today. If we can help you, call in. That phone number is down at the bottom of the screen. Tomorrow, we're going to be discussing something that is really important. If you are on a Medicare supplement plan, whether that's a Plan G or a Plan N or maybe even a Plan F, and you have that plan and you've seen it go up in cost the last couple of years to a point where you're like, man, this just feels like a lot. You have options. And so tomorrow we're going to be going through what those options are and how you can save money on your supplement plan. So join us tomorrow to learn about that. Guys, if you need immediate help, need to talk to somebody on our team, comparing Advantage plans, comparing supplement plans, getting drug coverage set up, dental coverage, whatever it is, we'd love to help you. The phone number for that is 833-833-3661. 833-833-3661. We are open from 7 a.m. to 7 p.m. Central Standard Time. Help people all over the country. There's no cost to you. We're licensed in all 50 states, and we would love to serve as your Medicare broker. So anyway, thanks for being with us today. We will see you tomorrow.